Dr. James Smouse. I received my certificate in 1978 and decided to set up private practice in Marietta, Georgia. I'm one of the founding members of Atlanta Oral and Facial Surgery, and the other two are Dr. Wonderly and Dr. Fryhout. We were all residents together, and that sort of became the core of the organization. What I'm known best for is probably as the founder of Atlanta Oral and Facial Surgery here in Georgia. I have found that patients are not truly interested in how much I know, or they don't really care how much I know. What they care about, or what they want to know about, is how much I really care. I think just during that short relationship with them, I call them, I give them my cell phone, I make myself readily accessible, and I just service whatever that patient feels they need, and it varies with every patient. I think the main thing a patient should expect in my practice is timeliness. I do not appreciate people waiting. My staff, I tell them what I expect of them, and the staff should be courteous, and basically I feel that the patient's time is very valuable, and I just expect them to be treated in a timely fashion. I think this location can service a large segment and a much larger geographical area than just Roswell, and it's just my job to get out there and meet the referrals and try to deliver the service that I know we can.
My name is Emily Akbar-Shahi, and I've been a patient with Dr. Smouse for a year. I came in to get 4 of my wisdom teeth taken out, and during the process it was very fast, and the staff made me feel really comfortable, and I was at ease with the procedure. Afterwards, for the aftercare, I was really informed on everything I need to do, and I would refer any and all my friends out to Atlanta Oral Facial Surgery.
All right, so I'm Dr. Martin Velez. I'm an oral surgeon. I practice in Roswell and Alpharetta. I graduated dental school in 1989 from the University of Texas Health Science Center in Houston. I then followed a general practice residency in New York City, where I established an experience with oral surgeons, and soon lead me to a want to follow oral surgery as a career. Aside from being a general dentist, following several years afterwards, I wanted to pursue oral surgery as a career, which then I pursued as an oral surgeon in the military. I actually served in the military as a general dentist for several years, as they do require, and I did my training at Dwight D. Eisenhower Army Medical Center and graduated in 2001 as an oral surgeon. I realized I wanted to be an oral surgeon. My experience in New York City with the trauma and pathology that one sees in inner city hospitals was a valuable experience for me. It's then that I kind of realized I wanted to follow that career path. In undergraduate and graduate school, you really don't see that, but once you start into a hospital environment, you see all the environment that's involved with oral maxillofacial surgery. I then pursued it with the military, which is an invaluable experience that I, receiving the military training in a hospital setting, but also in a field setting in a combat support hospital that I've served on several occasions. There's an invaluable amount of experience that one receives from that alone. What keeps patients coming back to our office, in my Alfred office and my Roswell office, I really do pride that I treat them as a gentleman, I treat them as a person, I listen to them, I really care what they have to say to me, and then we talk, we get to know each other. I think people appreciate my listening, but I understand there's an anxiety coming to a surgeon's office. Our staff, a dynamic group of people that from the front desk to the office staff and to the doctors, we want to treat you with professionalism. Understand that you are our family member as you walk in our office. I want all my patients to know that when you come see me, I'm on your side. I try to speak to you as a person, not necessarily always a patient. I want to educate you and help you through and guide you. I'm not going to make a decision for you, but I'm going to make you a smart patient so that you can make your own decisions. I pride myself in you being to feel comfortable, to feel at ease, to remove the anxiety that one sometimes comes with to an oral surgery office. We have the best technology. We have a dynamic group of people that work here, from the doctors to the staff to the equipment we use. We use the most modern techniques, ideas, medicines. We have a vast array of knowledge from people who are just recently out of residency, for the latest equipment and techniques, to the patient, doctors and staff that have been doing this, almost nearly 30 years. During a patient consultation, a patient will often receive a panoramic radiograph. If it's not sent with them from the pre-existing referral, we have a Kodak digital panoramic machine that will take an image to evaluate the maxillofacial structures. Most often, this X-ray machine is only to view hard structures, the face and mouth. This is how most patients are diagnosed for pathological disease or conditions where the doctors require prior to any treatment. The beauty of the digital panoramic machine is opposed to the old radiographs that were taken 15, 20 years ago that involved chemicals and processor machines. As the digital technology now allows the patient to have this done instantly with the third of the amount of radiation and the ability to store files and transmit files to within offices and even referring doctors' offices. Within the Roswell office specifically, and multiple offices within the Atlanta Orofacial Surgery group, we have the ability to take ICAT imaging, which is a 3D imaging, and it's what most people refer to as a CAT scan in a hospital setting. This is a modular system that takes specifically for anatomical structures of the head and neck, specifically are the regions of the mouth and face. This is very specific for pathology, for diagnosing conditions of the head, neck, and mouth. The invaluable part of this procedure as well, as opposed to a hospital procedure, is that it's a fraction of the cost, and with not having to make different procedures done at different facilities, you can all do it within our office.
Hi, my name is Ashley Baker, and I've been a patient of Dr. Velez's for almost 2.5 years. I initially came in to see him for a cracked tooth. I had a lot of pain. I couldn't eat, I couldn't sleep, I couldn't drink. It was just almost unbearable to live life with my tooth the way it was. I came to Dr. Velez's office to get the relief from that, and his office was wonderful. They got me in very quickly. They were always had a smile on their face. They were accommodating, and I came to see Dr. Velez the very next day. He walked in with a big smile on his face. He was just the most exuberant person. You could tell that he loved his job. He explained everything to me, right down to the anesthetic, to the procedure, to everything that he was going to do, exactly the way that he was going to do it. I chose to have a local anesthetic done. I wanted to be awake for my procedure. I just wanted to be able to see and feel everything, and I wasn't able to feel one thing because he numbed me up so well that I really just enjoyed being awake, honestly, to be able to have my tooth pulled, and it was a wonderful experience. He got it out very quickly. He did a great job, and I love him, and I highly recommend him for everything that related to tooth work, to surgeries. I've actually had my family members come to see him, and they loved him as well, and I would not send anybody else elsewhere because I think he's just a wonderful doctor.